Hello everyone, welcome to my channel. Today we are going to discuss about artificial intelligence for disease diagnosis. Artificial intelligence nowadays is booming like anything because of its machine learning, combining with the AI, so that it is predicting a lot of steps which humans cannot predict sometimes. For example, recently I read one of the article which says that the AI had detected the possibility of the cancer in breast cancer in one of the women. Okay, 4 years back only. Understanding. So, and also one more article I've read there. It shows that it explains that this AI, artificial intelligence technology, has come up with this particular when you use for eye scanning. Just by eye scanning, it can tell that whether the particular person is going to have any heart related issues diseases in future or not. So this is a huge revolution that is going to happen in the field of biomedical field, especially in diagnosis, disease diagnosis, that means detecting the diagnosis. Okay, but there are a lot of pros and cons that we will discuss. So artificial intelligence is nothing but it has wide potential. All of you know what is artificial intelligence. I don't go with the definitions. So here it has a potential to revolutionize the field of disease diagnosis by providing healthcare professionals to more accurate and efficient tools for identifying and treating the various conditions. The basic thing is we need to detect the disease properly, accurately, efficiently, so that we can give treat effectively. So that next it will be helpful for diagnosis, early detection, drug design. We discussed in the previous class. The same thing we explain here. Deep and detailed study. So for all these applications, AI will be helpful. Applications: image analysis, as we just discussed about in previous topic, X-ray, CT scan, MRI. The same stuff. See here. Now AI algorithm can be analyze the medical images. So in future we don't have to have no need experts like radiological experts, because AI will get to your image and it will compare with the machine learning data whatever it has got from the millions of billions of images already fed into it because of the machine learning, so that will take it and copy it and then it will compare to your image and that will tell that this person has got this particular disease. So that's how it going to be very helpful. Okay, so that way most of the stuff it will be this type of image analysis is known as a computer aided diagnosis. So next, data analysis. So AI algorithms can analyze a large amount of patients data, okay, such as electronic health records is there to identify the patterns and also trends that they may indicate a disease. In the future he may suffer from the heart attack. In the future he may suffer from the some brain disease. It can predict advance only by how, by the use of data. Okay, and that patient record itself will give you that. And machine learning, AML is nothing but machine learning. What we are giving, all the possibility diseases we are feeding, all the images are we are feeding, all the data we are feeding. With the help of that data only it is giving the answer. Okay, it is predicting. Next, diagnosis we discussed enough. To AI will help to identify the disease, and with the help of any symptoms or test results, or any with the help of patient information, AI algorithms can help the healthcare professionals or doctors to make faster and more accurate diagnosis, reducing the risk of misdiagnosis. Here humans can make error, but if you fed the proper data to the system will not make an error. So that is one of the advantage in diagnosis by AI ML. Next, personalized medicine. So algorithms, AI algorithm, that is artificial intelligence algorithms, can be used to create personalized treatment plans. Personalized medicine in the sense, for a particular person, I don't have to go for a doctor for every time wherever I want to take a medicine. That is called personalized treatment. That plans for patients based on their specific medical histories, lifestyles, and other factors. For example, AI algorithms can analyze a patient's medical history, lifestyle habits, and genetic information to recommend a best course of treatment for their condition. You don't have to consult many doctors and all. If you give all this data to the AI tool, it will give you the best course of treatment what you can have for a particular condition. That is what is called as personalized medicine. Next, clinical decision support. So for example, AI algorithm that can be integrated into the electronic health records. That means every hospital will have their patient records, where it will get obviously electronic health records only. So that AI can be integrated with this particular health records, which is having a lot of data, then to provide the health professionals and real time or a doctor's real time decision making support, so that they can based on the previous data or AML predictions, they can give the real time decision. They can make a quicker real time decision in the time of trauma or surgery, or what you say, the accident cases or emergency cases. For example, AI algorithms can provide physicians with the information about the best diagnosis test to order and the most effective treatment to consider and best ways to manage the patient care. So it will tell the physicians, okay, so you can refer this particular diagnostic test based on these particular results whatever I have received, and then you can also go for this is the particular effective treatment compared to the what you are suggesting, or you can suggest this one. That AI will only tell to the physicians, and then also it will tell you the best ways to manage the patient care, how exactly the patient can be managed in this particular disease or situation. That also it's going to tell. This is going to make a huge revolution in the field of biomedical field, that is for sure. So limitations, lack of understanding of underlying algorithms. That means there are a lot of algorithms, the very complexity is involved, very difficult to understand, making it, there is something called neuronal network here in the AI. Well, I had attended some workshops, so or faculty development programs. Even the expert who was explaining was telling that it is difficult for him to understand it. So imagine how difficult it will be. So making it difficult for healthcare professionals to interpret the results. So this can lead to the confusion and mistrust of AI based tools, because they won't be knowing how to operate it, but they will be blaming AI tools. So particularly among healthcare professionals who are not familiar with AI technology. So that is a lack of understanding of underlying algorithms. Next, bias. AI algorithms may be biased, sometimes leading to the inaccurate or unfair diagnosis, because AI algorithm, how it works based on the data what you fed. If the data is not proper, then it is biased, so that will not give you the correct results. For example, AI algorithm is trained on the data from the predominantly male population, so it may not accurately diagnose conditions which are going to affect the women differently, so that is biased for a man. Next, regulations. The use of AI in healthcare is heavily regulated, definitely heavily regulated, and it can be challenges to get approval for the new AI technology. We can't just develop new technology and can use in hospitals. It has to go through a series of regulations. I have discussed, if you remember, in the previous module when we were discussing about we are having the FDA in US and European Union and Japan. Okay, we will be having these different evaluations. I mean, regulatory bodies. We need to apply there, take a permission from them, then make sure that this particular algorithm is now not going to affect the humans. That this stuff and all will be there. It takes a lot of evaluation processes. It takes very difficult. They will go under very rigorous evaluation processes before they can be used in healthcare. Next, last, the cost. So now development and implementation of algorithms can be very expensive, so which may limit, because it requires a lot of data. That collection of data itself is a lot of time, and then building the softwares and getting the computer systems and all, it will be very tedious job. Now, which may limit the access to the most of the technologies for some patients and healthcare facilities. Only a rich can have this facility available. So this is particularly true in low and middle income countries where access to health is already limited. So it is going to affect in the countries like South African countries like Uganda, and even the middle kind of countries. So even India also comes in most major part of the India. So we are not access to the even oxygen cylinders. People are dying. People have died. We have seen the people dying without oxygen cylinder during the time of Corona. And even the Bangladesh kind of what you say, Bangladesh, Sri Lanka, Pakistan, Afghanistan, these kind of countries which are still very underdeveloped. It is going to be very difficult, and it is going to be very costly. So despite these limitations, AI has the potential to revolutionize the field of disease diagnosis. It will give the healthcare professionals with a new and more accurate tools of identifying and treating the wide range of the conditions, so that it will give you what do you say, the accurate and data, so that based on the data accuracy, it can give you this is the disease which is having, or this might be the disease he might be exposed in coming years. that kind of things and all it will give. That is very revolutionizing in the field of how do you say, medical history. But what happens here, the only major thing is that every doctor, every healthcare professional has to go to has to understand the AI tools, or else it is going to be very difficult for the implementations, especially countries like India. Okay, and maybe in even the developed countries also it will be going to be helpful, in including Australia, New Zealand, Japan, and even China. Okay, although it will be very it's going to be very tough for health professionals, but it is going to make its way, because we know that our humans, there are a lot of technologies has come, and we say that this technology has come, it will take job away. They have taken job away, but suddenly there will be paradigm shift. The human brain is so powerful that it will learn something new, and it will adapt to its particular new evolution, and that's what we have been doing since billions of years. And trust me, AI, even AI, not only AI, there will be hundreds of technologies going to come, but no technology can replace human as of now. Whatever the science is involved, but no technology can replace our brain or heart or anything else. Okay, that's it for today.